This video is about getting the results from your smear test. It is for women with learning disabilities, autistic women and their support.
A smear test is sometimes called a cervical screening. You'll get the results of your smear test 2 weeks after your appointment. If you don't get the results within 6 weeks, you should ring your GP to ask about them. Try not to worry if your results are late. This doesn't necessarily mean there's anything wrong. The results of your smear test will be sent to you in the post. Your results letter will have the NHS logo on the envelope. It's very important that you open the letter. You can ask a friend, family member or support worker to read the letter with you. A smear test checks for a virus called human papillomavirus, HPV, which can cause problems like cancer. Most people will have a normal smear test result. This means that the test did not find HPV and your risk of cancer is low. If you have a normal smear test result, you'll get a letter saying when your next test is due. If your letter says that you need to have more tests, this might mean that the test has either found HPV and there might be some unhealthy cells in your cervix. Try not to panic. It's unlikely you have cancer. You will be asked to come for more tests to check your cervix. Some women will be asked to go to the hospital for a different test called a colposcopy. This test takes a closer look at your cervix. You can watch our video about colposcopy. Sometimes a smear test result is not clear. This means the test couldn't tell if your cervix was healthy or not. If this happens, you'll be asked to come for another smear test. If you have questions about your test results, you can call your GP and ask to speak to a nurse in person or over the telephone. Most women won't need a checkup for their cervix in between their smear tests. Unless you notice you're bleeding from your vagina when it's not your period, you're in pain or bleeding during or after sex, or you notice anything different, then you should tell your doctor.